All right, ladies and gentlemen, today we're going to talk about why we need to be able to have a solid toolbox of techniques for manipulating fascia. Have you noticed the last 2 or 3 years we've seen an explosion of myofascial classes that people say they're just specifically focusing on the fascial tissue? Well, there's a huge reason for that. Fascia determines the position of everything else in our body. Fascia determines muscle position. Muscle position then determines bone position. So when we're talking about structure, when we're talking about functionality, if we're not addressing the fascial tissue, honestly, you're not going to really be able to make any long-term changes within your patients. A lot of people report to me that they can get changes out of their patients. They last 2 or 3 days, and then the clients report that they're having similar aches and pains coming back, even though that they're getting massage once a week. There's a reason for that, and that's because you're not changing the structure for the long term. We like to talk about giving a fish instead of teaching a fish mentality. Is that if we're only just doing massage and if we're only doing relaxation work, even if we're doing deep tissue, you hear that term a lot. Everybody on their business card lists, I do deep tissue work, but what does that really mean? Does that mean that you're working deep pressure? Does that mean you're working deeper layers within the body? So that's something that is hard for a lot of people to clarify. And what we really want to be able to do is we want to get to the point to where we want to manipulate the deeper layers of fascia within the body and not just apply deep pressure. One of the examples that I like to use when I'm talking with my clients about how the body works is a simple package of spaghetti. So you can use any brand you want, it doesn't matter. What happens is that if we were to look at this package of spaghetti and compare the individual spaghetti noodles to muscle fibers, muscle cells, and if we were to compare the wrapping that organizes and holds this package of spaghetti together to the fascial tissue, and what were to happen if we were to take off that wrapping and then drop the noodles? They would go all over the place. Because this wrapping keeps the noodles together, we have a unit here. Now, if we were to break that down and go more individually, if we were to pull out an individual noodle, that noodle, if we were comparing to a muscle cell in the body, would be surrounded by a layer of fascia. We would have multiple noodles in a similar area, all encased in their own layer of fascial tissue. And then we would have another piece of tissue that would be encasing that grouping that together as a fasciculi or a muscle bundle. So now that layering effect happens all the way out to the superficial fascia and then our skin. Now what happens? Why is this so important? And understanding the layers of what's going on. Well, if each individual noodle is supposed to slide in and out of this package with ease, or in our body, if a muscle cell is supposed to be able to move without restriction, when we're overused, when we're underused, or when we get damaged, if we have any kind of trauma, that fascial tissue starts to shrink and it gets real sticky. So instead of that individual muscle cell being able to slide like it's supposed to, it starts pulling on more muscle cells, and as that's moving, then it pulls on more muscle cells. So the next thing you know, the body is trying to do a very simple action, and it's incorporating every single muscle fiber in that region because everything is all glued together and we don't have any differentiation because that fascial tissue is gluing all that together. So if we don't get to a point when we're working with our patients of manipulating that fascial tissue and getting that to let go, my opinion is we're not seeing a long-term change within our patients. Is that each week they have to come back because we're really not changing anything. So we really want to look at how we can change the tissue long term. In our classes, we offer a very, very heavy techniques weekend where you're going to be receiving over 30 different techniques this first class to be able to work the neck, the legs, the back, and the pelvis to be able to start opening up those fascial layers, because if that fascial tissue can't slide like it's supposed to, those spaghetti noodles can't slide like they're supposed to, the body ends up doing more work than what it should. That facilitates inflammation because then things are moving under pressure, and or we can think about it that way too. Think about all the nervous tissue and the vasculature that would be with these muscle cells. If we put too much pressure on there, all of those are open tubes, so it starts to close the tube. So the neurological flow is not as much as what it should. The vascular flow is not as much as what it should. The lymph tissue can't move through the fascial system like it's supposed to, and then the basic elements of the muscle cells can't contract and expand with ease. And ultimately, when you see someone who's moving in a very graceful fashion, dancers, martial artists, people who get a lot of body work, especially fascial work, you see their movement quality is completely different. So over this weekend's class, we're going to give you a very, very large toolbox of tools that you're going to be able to use in all of the most common regions: the neck, the knees, the hips, the low back. It doesn't matter what region it is. We have a massive amount of tools. And the key when you're working with fascia is that you have to do it in a certain way. Because fascial tissue is heavily loaded with mechanoreceptors, if you're stimulating the fascial tissue too much or too quickly, you're going to find that it's actually going to contract and guard even more. You see those patients that come in and say, oh, I want the deepest pressure that you can apply. Then you start applying pressure and they're jumping up off the table trying to get away from you because everything's so sore and painful. Well, the techniques that we have are going to allow you to access those deepest layers of tissue possible with very little work, to where you're not doing any tissue damage on the outer layers, which will allow the body to open up for you so you can get to those deep layers within the body. So when we say structural based deep tissue, that's what we're referring to. We're referring to the layers of the body and not just hard pressure, because people can get hard pressure anywhere. So if you really want to have your practice explode, really get to a 30-40 client a week practice, maybe you don't. Maybe you have 10 to 15 clients a week that you want to see regularly, but you want to be able to make more changes in their structures than what they can ever dream possible. Let's get our clients functioning at a higher level, and let's get them doing things that they never thought they would do again. You can go to www.massagelearningcenter.com to be able to register for any of our upcoming classes. We're coming to Pensacola, Birmingham, Alabama, Portland, Seattle. We're going to Hawaii in the fall. We have classes all over the nation to be able to allow you guys the opportunity to come experience this amazing and life-changing work. I hope you have a great day, and if you have any questions, give us a buzz, 509-891-2368. We'll be able to answer any questions that you have. Have a great day.